My name is Dr. Tahir AKHTAR and I am a Clinical Director in Intensive Care Medicine. Today I'll be talking to you about PPEs, that is the personal protective equipment. PPE means any device or appliance designed to be worn or held by an individual for protection against one or more health and safety hazards. The use of PPE at work is covered under the laws of safety, health and welfare. So why do we need PPEs in COVID-19? Because correct PPE must be worn by the healthcare professionals to avoid direct contact with the virus. Coronavirus can survive on various surfaces from few hours to many days. So what are the types of PPEs? So the most commonly used COVID-19 PPEs can be classified into breathing protection, eye protection and body protection. To protect breathing, two types of masks are in use. The surgical fluid repellent masks, as shown here, they provide protection against droplet infection for up to 2 meters. And the respirators, they provide protection against aerosol and mist. The respirators shown here are FFP2 respirators. They provide up to 95% protection against coronavirus and hence sometimes labeled N95. The FFP3 masks are required for protection in aerosol generating procedures, mist or wherever there is the possibility of aerosol. More details on their use in my next talk. The respirators, both FFP2 and FFP3 masks, they must fit properly on the face to avoid virus getting into your lungs. All persons must be fit tested to confirm best type of mask that fits their face. If no mask can be found to provide perfect fit, a hood may have to be used instead for these individuals. These are the types of hoods that can be used if an appropriately fitting mask cannot be found. Now the eye protection consists of goggles and visors. The goggles must be worn to prevent virus coming in contact with conjunctiva. If there is possibility of splashing, then visor eye shields must be used in addition to the goggles, like these. To protect your body, use water-repelling surgical gowns and coveralls. If there is possibility of splash to any other part of the body, then further protection must be used. To protect your body, you must wear surgical coveralls and appropriate hand protection. Use long gloves to protect your arms and second pair of gloves to provide further protection. When choosing a PPE, it is essential that you should choose products which are CE marked in accordance with the Personal Protective Equipment Regulations 2002. If more than one item of PPE is worn at the same time, make sure that they can be used together. For example, wearing safety glasses may disturb the seal of a respirator, causing air leaks. Instructions and training of the people is very essential. Train people to remove gloves without contaminating their skin. Tell them why it is needed, when to use it, and what are its limitations. Now, here are some of our team members who are wearing proper PPE. Here they are, ready to save lives. But can you, in this picture, identify some professionals that are either using inappropriate PPE or they are missing PPE? Remain safe. Wear full protective equipment. Thank you.